I'd love to touch on the whole mind-body connection and the trauma body, the trauma jaw connection, I guess maybe we could
Yeah,
say, because that fascinates me I am a bit of a clincher, and also one of my kids, he's a grinder. We're working on some airway myofunctional therapy for him right now, which is a whole different rabbit hole. But
yeah.
I'd love to hear about the connection between, yeah, nervous system and jaw clenching and grinding and TMJ, those kinds of things.
That's a very broad topic, Aaron. And so there's been I think, a little bit of a myth in my profession that the reason people would develop a habitual grinding of the teeth is because of stress. I don't know if you've ever heard that before,
Yeah.
but it's kind of like, oh, you need to manage your stress because you're grinding your teeth away. And I think there's a lot more to the story. Yes, stress in your life can exacerbate any underlying imbalance in your body, right? If you're in a really good phase and you're taking care of yourself and you're not too stressed, most of your body's going to feel better. But as soon as stress ramps up and you have any propensity for problems with your jaw, it could ramp up. So I don't think it's a cause and effect. What I do think is more related is how the jaw joint, the TMJ here, relates to how your teeth fit, because that's all part of the same system. That is the joint. It's all the teeth plus the two TMJs, temporal mandibular joints. You can't separate them. They work in unison. You can't just move one jaw and not the other. And
Hmm.
you can't have any function without the load bearing part of the system, which is the teeth. So there's all kinds of nervous system feedback from this really highly innervated part of our body, which is the teeth and the mouth, the lips, the tongue, back to the brain. And if there's a discrepancy between the way the jaw fits and the way the bite fits, this is triggering a lot of kind of warning signs to the brain. And so a lot of clenching and grinding, in my experience, is really because of this kind of imbalance that a lot of people have. And it just can ramp up in times of stress. And
Mm.
strangely, it also ramps up in sleep a lot of times. So
Yeah.
that's why people sometimes have a night guard, because it's just trying to mitigate the stress of grinding and clenching during sleep, because the brain can go into hyper mode trying to, in my opinion, kind of rectify the discrepancy and muscular imbalance that's in the jaw. So that's one of the big connections that I see between emotional stress and TMJ.
That's so fascinating. So, what do you do? How do you support somebody when
Mhm.
that's happening?
It's something I've been working on for decades, and I've tried and learned and studied and trained with a lot of different schools of thought over the years. The modality that I've landed on that seems to be most predictable and successful is called orognathic bioaesthetics, and it really aims to balance the system first with the use of an appliance that is kind of a whole topic in itself. But and then once the system's balanced, you can actually see where the discrepancy is and make alterations a lot of times to the form on the teeth to correct the bite, replace what's been worn away, bring harmony back to the system. And in reverse, it's so amazing, Aaron, how when that's in harmony, the effects on the whole system are incredible. And I've seen people who've had widespread effects from balancing this whole part of their body all the way down the chain of their musculoskeletal system.
Wow.
And we have found in my office that people who go through a course of treatment with that, they kind of light up, their eyes get brighter, they sit taller, they're laughing more. It's a really profound aspect of our health, because I think it's so critical to our survival to be able to eat and chew and
Mm,
speak and smile. There's so much of our nervous system allocated to our jaw joints in our mouth
yeah.
for breathing and taking in nutrition and intimate contact. And so when it's not in good function, it's got very severe effects. But when it is in function, it also has very awesome effects.
So you're saying, I mean, this ends up becoming a physiological stressor to the body and the brain, right? So it,
Absolutely.
yeah. So yeah, because I'm wondering, it's kind of a chicken or egg thing. Is it the emotional stress, the trauma that triggers the clenching and the grinding and the all of that.
Mhm.
And then reversing that can help bring relief to I mean, is that what you're saying? It kind of works both ways in the way like the
Yes,
brain gut would?
it does.
Yeah,
That's what I've learned.
that's
Yes.
fascinating. So what is the device that you
The one
use?
that I use is called a MAGO. It's a maxillary anterior guided orthotic, if that's the acronym. And it is a very specialty device that snaps onto the top teeth. And what it does is in an artificial way, because it's a piece of plastic that I can adapt and mold as their body heals, that helps balance that, what I was just telling you about. It helps put the jaw joints and the bite in harmony over time. So it's meticulously adjusted week by week as this person's system settles until they're feeling really good and until it's not changing anymore. And then we can actually make a proper diagnosis of what is the discrepancy and what are the pathways that we could use to balance that out without having to you can't wear that appliance forever. But the
Right.
Mago is a magnificent tool. It's very different from other night guards or bite splints that I've utilized in other schools of thought. And it's a big part of the training of an OBI dentist is
Hmm.
learning how to navigate that appliance. But it can
Wow.
have an emotional component too. People are coming in weekly and have this adjusted, and we'll see them go through releases of emotional trauma. We'll see them
Wow.
feel better and better, stronger and stronger. Literally, they get increased strength of their muscles when their system's not fighting this. And this is where a lot of times having their allied healthcare providers, especially people well versed in craniosacral
Hmm.
or different acupuncturists, can be really tuned in, physical therapists, and can help move the process along by helping the system release, helping the muscles and the fascia and the ligaments to let go of toxicities that have built up because
Hmm.
of the stress in the system and let go of muscle tension. So I really, really like a collaborative approach with other care providers.
Yeah. It's so interesting.